Throat ulcers, causes and symptoms. At times, a person may have an ulcer in the throat, esophagus, or voice box that can cause problems eating, drinking, chewing, swallowing, or talking. Many things, including chemotherapy and radiation, fungal, bacterial, or viral infections, cancer, stomach acid reflux, and other conditions that cause inflammation and irritation can cause these ulcers. Ulcers may develop in the throat, esophagus, and the voice box as a result of many conditions and causes. Causes. Ulcers found in the throat may be related to or caused by certain chemotherapy or radiation treatments for cancer, bacterial infections, fungal infections such as thrush, which is a yeast infection caused by Candida albicans, viral infections such as herpangina or mouth blisters, and hand, foot, and mouth disease which are caused by Coxsackie A virus. Conditions such as Behçet's syndrome, which is an inflammatory disease that causes ulcers to form in the mouth, genitals, and other areas of the body. Cancer. Ulcers found in the esophagus may be related to or caused by conditions such as gastrointestinal reflux disease or GERD. The use of certain medications such as non-steroidal anti-inflammatory drugs and some antibiotics. Infections such as Candida species or yeast, herpes simplex virus or HSV, and HIV. Overconsumption of acidic foods such as those containing citrus and vinegar, and drinks containing caffeine and alcohol. Ingestion of corrosive agents such as ammonia and sodium hydroxide. Chemotherapy or radiation treatments for cancer or mucositis. Excessive vomiting. Allergies. Ulcers or granulomas found on the voice box may be related to or caused by conditions such as injury from intubation, where a tube is passed down a person's throat into the trachea to aid in breathing. Laryngopharyngeal reflux, an inflammatory condition caused by GERD, where stomach acid gets into the lower throat and voice box. Excessive coughing or use of the voice. Cancer. What are the symptoms? Symptoms associated with throat ulcers may depend on the underlying cause and include a sore throat, fever and chills, joint pain, difficulty swallowing, pain with swallowing, stomach acid regurgitation, chest pain or burning, or heartburn, feeling as if there is a lump in the throat, nausea, vomiting with or without blood, choking sensation, voice changes, frequent coughing or clearing throat, taste changes, acidic or bitter or sour taste in mouth, smelling changes, ear pain. Diagnosis. In the first instance, doctors will do a physical exam and evaluate a person's symptoms. They may then need to take throat cultures using mouth swabs. Sometimes blood test and urine test may be required. Home remedies. Lifestyle changes and modifications that can be made to treat and manage the symptoms of throat ulcers may include avoiding acidic or spicy foods, mouthwash or drinks containing alcohol and tobacco smoking, eating soft, creamy and mild foods such as cheeses, mashed potatoes and yogurt, avoiding rough and hard foods such as chips, nuts and some fruits and vegetables, rinsing mouth or gargling, Do not swallow with a mixture of water, salt, and baking soda. Eating and drinking lukewarm or cold foods and drinks, frozen fruit or ice pops may be soothing. Eating sour cream before each meal to coat the mucous membranes. Staying hydrated by drinking small amounts of liquids throughout the day. Reducing risk for GERD by maintaining a healthy weight and avoiding irritating acidic foods including tomato-based foods, citrus, mint and chocolates. Avoiding eating large fatty meals right before bed. Prevention. There are measures that people can take to prevent throat ulcers in some cases and may include staying healthy, prevent the spread of communicable illnesses which can cause infectious throat ulcers by practicing good hand hygiene and avoiding contact with people who are sick or have an infectious ulcer. Keeping surfaces clean can also prevent the spread of infection. Taking medications properly. Take all medications as directed. Avoid taking pills without water, just before lying down and right before sleep. Stop smoking tobacco or drinking alcohol. Avoid or stop smoking tobacco and drinking alcohol, which can make throat ulcers worse and increase a person's risk for cancers. Manage risk factors. Talk with a doctor about managing any conditions that may lead to a higher risk of developing an ulcer such as diabetes mellitus. Prevent or manage acid reflux. Maintain a healthy weight. Avoid acidic or trigger foods and avoid large fatty meals. Elevating the head of the bed with blocks or risers may also be helpful. Healing time. Each situation is unique. Individuals should discuss the prognosis with their doctor. Anyone experiencing new or unusual symptoms should contact a doctor as soon as possible, as medical attention may be required. People experiencing any of the following should contact a doctor. Pain unrelieved by over-the-counter medication. Symptoms not relieved with over-the-counter antacids or other GERD treatments. Inability to eat or drink. Sores lasting for more than a few days. Anyone experiencing the following symptoms should seek immediate medical attention. Chest pain, shortness of breath, racing heart or lethargy. A headache, vomiting, neck pain or a stiff neck. Changes in behavior and flu-like symptoms. Vomiting large amounts or vomiting bright red blood. Vomit that has the appearance of ground coffee.